Hello everyone, my name is David Kent and I'm the president and founder of Kent Health Systems. I am also a therapist and have been a therapist for many decades. What I have developed, the Kent Health Systems, is an overall way to educate and communicate with your patients regardless of the environment. Regardless of whether you do outcalls, whether you work in someone's office like a chiropractor or a medical doctor, whether you're working in a spa or you have your own clinic, this system is designed to work within all of those different environments. It was actually created in all those environments as I grew as a therapist over the years. So how does this system work? Well, it has many different components, and each component stands on its own or can work together as an entire system. Initially, of course, there is a contact with your client. Whatever that client contact is, we want to make sure that we're getting information that protects both them and as you as well, and allows you to have the information to not only safely deliver a treatment, but be effective and to be efficient, and to have the information you need to either communicate with other healthcare providers or to your clients so that they understand the benefits of your therapy. So we'll start with the forms to gather certain information. Then there is a postural analysis that can be integrated very quickly these days, even with the use of the technology of a cell phone. We can instantly take photos, and now posture charts, not only do they hang on walls, but there's also formats designed that you can take into your client's home and hang right over a door. And there again, in just a moment, you can take a picture with your cell phone and you can zoom in and show them the high shoulder or the forward head posture so that they understand why their neck hurts and why they have headaches, or show them the stress that's on their back and where that back pain's coming from. So then after we've looked at the posture, there are a few things we need to do. We need to educate the patient, we need to treat the patient, we need to develop a treatment plan, and the system allows us to do that. I found that I couldn't hold all the information in my head. I found there was no need to hold all the information in my head. What was more important is that I was focused and connected with my client, with my patient, with the person who was paying me to help them. So let me walk you through that system. I simplified it. I've owned all the videos. I've owned all the DVDs. And I needed to make something for me, for my attention span, which can be short, which allowed me to look information up quickly, instantly, reference it, and understand what do I need to do when this unique situation confronts me in the clinic that I don't see every day. But I know the information. I don't want to look into a book in front of the patient because it looks like I'm looking in the user manual and I don't know what I'm doing. So this way, I've taken all the information and I put it right on the walls. I put my cliff notes, my most important notes, and I hang them on the wall, or I have them in a flip form when I'm doing an outcall, and I'm able to now educate the patient so they can make a good educated decision for themselves on the benefit of the therapy. Let's look first at we've talked about posture. We understand they may have a high shoulder or a forward head posture. Well, they may also have not only the neck pain, but a headache. So let's talk about that relationship on trigger points. First off, everything in my system is color-coded by body region. Anything that has to do with the head and neck is blue, whether it is a trigger point wall chart, whether it's a trigger point flip chart, or whether it's a DVD program. And that color code continues not only with the programs, where the DVDs are even the same color and the manual's the same color, but also all of the information is cross-referenced. We use the same images inside of the manuals that you see on the trigger point charts, the same images that you see on your DVDs, and inside of your manuals are the same images that you're seeing on the video. That way later, when you need to go back and look something up quickly, but you can't watch it on your computer or watch it on your laptop, then you could just look in the manual and have the same pictures and know exactly, oh, here's this trigger point and it's cross-reference to this trigger point chart. Again, everything's connected, keeping it simple. I've taken the charts and I've created columns, you'll notice. Column 1, for example, on the head and neck chart are all the muscles on the posterior neck, starting superficial with trapezius, and then going in layers deep. Another column are all the muscles if you're working with a patient with TMJ. It would be muscles moving the jaw. That we have in a separate column. Any other muscles affecting the face and head are in column 3, and we start with lateral neck, and then anterior neck in column 4. And throughout everything, again, not only do we color code, but we have the columns. So when you're working superficial to back, superficial to deep on the back, or whether you're in the hips, again, gluteus maximus, minimus, medius, it's always laid out in layers. I want to show you something else that makes this system very unique and user-friendly is I've integrated all the research that has been done by so many medical doctors and other professionals, and it's well documented. And I need to deliver that information quickly to the patients. Sometimes we only have a few minutes. Maybe it's a 10-minute chair massage in a unique environment that you're working in. And you need to determine what muscles could I treat fast, quick, and effectively to eliminate this headache, make this client happy so that they'll continue to purchase more treatments from me and refer their friends and family. So let's take a quick look at that. We've broken down different areas by color zones, making it very simple. Here we see the head and neck is broken down into multiple colors. I think you can also see that each muscle box has multiple small little color boxes within it. I also need to show you a few other things about the chart. First off, it's anatomically correct. The same model that you're seeing on the charts is the same model that I utilized in the DVDs. Also, what we did is we measured this model, and then we had a graphic artist draw and paint the muscles and bones so they're anatomically correct, and then with this digital age we were able to superimpose that. So when it's like you're looking at your client right through the skin, the white X shows the most common location of the trigger point based on research in the muscle. These red areas that you see are the most common referral locations. A solid red area, like in the temple, would mean a higher percentage of people reported that pain during these studies, whereas the dotted or steepled areas means a lower percentage reported it. A muscle like trapezius, trigger point number 1, which is the most common trigger point in the body, and many of our clients will come in talking about pain starting in the temple, going to their neck. Trapezius, trigger point number 1, as we can see, fires through 5 different color zones of the head. Is this making sense? What these little boxes allow me to do quickly, let's say a client comes in and says, I've got temporal headaches. I want to show you how quick I can make sure I never miss any of the muscles that are involved with that pattern. So they come in, they tell me it's that they've got neck pain, they've got headaches. We've looked at their posture on the phone. I've already showed them they've got the forward head posture, they've got the high shoulder. I bring them to the trigger point chart and I tell them I want to educate them a little bit about the muscles that may have trigger points within them during today's treatment. And real quickly, they told me that it was in the red area, and I can ask them, show me where the headache's most intense and what color area, and they point to red. Me as a therapist takes my wet erase marker and I see a red dot. Instantly, I scan down, red dot, red dot, red dot, red dot. I think we can see this. These are all the muscles I've just circled with trigger points based on the scientific research of Drs. Travell and Simons. If you only had a few minutes, I have it cross-referenced somewhere else on the chart for you as a therapist. Up here, I've got a small little red box, and I've listed all the muscles in the order of their significance, referring pain into the temple based on that research. So it would tell you exactly here, trapezius trigger point number 1 would be the first muscle that you would target, because most commonly that refers there. You only have a few more minutes, you'll come back into your list and you'll see it's sternocleidomastoid sternal head right over here. So we've got all the patterns broken down, and at the end, what I do with my clients at the end of the session is I review their trigger points with them. I explain to them that this was a classic trigger point and not weird that their muscles in their shoulder was referring their pain to their head, how that was connected to posture. I can tell them which muscles did not have trigger points involved. I can scale it for them on a 1 to 10 scale, saying, listen, 0 is no trigger points in a muscle, and what we located in this muscle on a scale of 1 to 10, I'm giving a 12, because sometimes those muscles everywhere you touch have a trigger point in them. Now the client understands that you understand. They know that you have a program, a protocol, a plan on how to eliminate it, that there's a reason for those trigger points that have formed in their body, that you have the resources to evaluate it, assess it, and design a treatment plan. You also have the resources and the skills to continually go back, review, cross-reference, and have it all at your fingertips. And some of you have looked at all this and say, it sounds great, David, but I'm not so sure I always know how to do posture. I know how to look at it. I can take a picture, but it's breaking down the pattern that sometimes seems a little overwhelming. And I've got one more thing. I know this seems like the Ginzu, what else? But it was the tools that I needed in the treatment room. It was I needed to look it up. Look at how many muscles and bones there are in the body, and they all are pulling in a different way. So we've evaluated, we've educated them on the trigger points. You've got a posture pattern that we want to break. I've got one other chart that I like to reference. Again, we talked about the color coding. Blue for head and neck. The purple, which is the torso, the spine, thorax, and abdomen. The green areas, again, in the charts, the flip charts, the DVDs, everything cross-referenced. Even when I'm on the road at a health fair or I'm working in someone's home, I'll utilize the flip charts. Again, column 1 on a wall chart would equal column 1 on my flip chart. So column 1 on the green wall chart is page 1 on the section of the flip chart. Same images, same color coding cross-reference. So with that, you have all the tools right down to this last one I'm going to talk to you about called the muscle movement chart. Again, it's in a wall form and a flip form for the various environments that you work. So if you looked at someone's posture, and again, there was a high shoulder. We talked about green being the color for upper extremity, and I'm going to move to this muscle movement chart. So we see all the various colors here. And if it was a high shoulder in that photo, you just go to green for upper extremity. You would find scapula, you'd look up elevation, and there are all the muscles listed for you. Let's say someone came in, they were having a shoulder problem, and they say, I can't do this. Well, all you have to do is, if you know that movement, you can look up abduction, adduction, and see which muscles are creating the range of motion, which muscles are painful when they engage them. If you resisted that muscle and they have pain during the movement, now you know very well what muscles we need to take a look at and target. You'll understand all these different situations. And then the question is, what is the normal range of motion of their neck, their head, their knee? The answer is on the chart. Again, you don't need to have every answer in your head. What we need is the ability to find it quickly and immediately and present that information clearly in a way that makes sense to our clients and in a way that they help feel empowered to follow our recommendations, to follow through with continued therapy, and to tell their friends and family and coworkers your ability to help others. So thank you for your time, and I look forward to talking to you in the future.